The incident that hospitalized 6 medical workers, including 1 doctor, was so alarming to the staff at Riverside General Hospital that the emergency room was evacuated to the parking lot.
It was a scene right out of some science fiction horror movie or medical mystery. One day, emergency room workers started collapsing with sudden unexplained symptoms. They apparently tried to provide emergency medical care to a strange patient, which was oozing with toxicity. And I'm not talking about an average Twitter user. A 31-year-old woman was brought by an ambulance to emergency room at the Riverside General Hospital in California. She was suffering from late-stage cervical cancer. This woman was in severe pain, having difficulty breathing while also vomiting. She had also rapid heartbeat and incoherent speech. She was dying. So she was rushed to emergency room where medical team administered the sedative Valium. The medication seemed to not work, and her condition was getting worse by the minute. So the emergency caregivers decided to use the defibrillator to restore normal heartbeat. To connect the defibrillator to Gloria's body, the emergency team removed her shirt. That's when the mysterious and haunting events of the evening started. The emergency medical team helping Gloria saw that her skin had a layer of strange oily luster, and the fruity garlic smell was coming out of her mouth. Not sure what's going on with the patient, medical team kept working on helping her, and the nurse named Susan Kane drew blood from Gloria. As she drew blood from the patient, Susan sensed the smell of ammonia coming from the blood, something not very common. Susan passed the syringe of Gloria's blood to Dr. Maureen Welsh, and she confirmed the smell of ammonia, which was coming from the blood sample. The syringe was then passed to resident Dr. Julia Gorshinsky, who saw something unusual in blood, light brown particles that looked like crystals. Just then, the nurse Susan Kane fainted. She was taken out of the intensive care unit. Julia Gorshinsky felt sudden sickness and fainted. Next, Dr. Maureen Welsh also lost consciousness. This mysterious series of 3 emergency caregivers around this patient passing out, one after another, was still only the beginning of the nightmare at the Riverside General Hospital. Julia Gorshinsky soon regained consciousness, but her sickness didn't go away. Instead, she started showing symptoms like uncontrollable muscle spasms and difficulty in breathing. The mysterious sickness in the emergency room started affecting many other emergency workers, and a total of 23 people fell sick to various degrees and had to be removed. Let's just stop right here. Imagine trying to help a patient, but as soon as you are in a close proximity of that woman, you start to feel ill yourself. It almost feels supernatural, as if she is cursed or something, kinda spooky. Back in the emergency room, a small brave team continued to try restoring the heartbeat and breathing of Gloria Ramirez, but they failed in bringing her back. About 45 minutes after she arrived at the hospital, Gloria died, but the strange wave of fear that started with the sickness affecting the hospital staff continued. The hospital staff felt that Gloria's body had some kind of toxic effect that was a threat to people coming in contact with her. Hence, her dead body was placed in an airtight aluminum casket and was moved from the hospital for autopsy by a special team wearing hazmat suits. The hazmat suits would protect them from potentially toxic effects associated with the corpse. It's almost like this woman is some unknown dangerous life form or something. The mystery of what caused the emergency team's sickness at the hospital only got deeper. A number of explanations were put forth to answer the questions haunting people's minds. The first hypothesis is that some kind of invisible toxic fumes were emanating from this woman and made all surrounding nurses and doctors sick. A Health and Human Services Department came to the hospital and found no traces of these fumes, so they suggested that this was just a mass hysteria among the hospital workers. But hospital staff categorically rejected this hypothesis and were even offended by their logic. I mean, They are correct. This hospital worker literally almost died. So after that, 3 autopsies were conducted by the coroner. But remarkably, nothing interesting was revealed at first. Then they sought help from even smarter guy, who was nuclear chemist Patrick Grant. He did some unique tests and found out that she had taken some multiple painkillers to relieve the pain which was caused by her cancer. But one chemical in particular caught Dr. Grant's attention. It was dimethyl sulfoxide. Apparently, some people take this chemical to relieve pain. It can cause the garlic-like smell and create oily sheen on skin. But why this chemical was capable of causing so much havoc in the emergency room? Why did everyone get sick staying near this woman? Well, this chemical isn't dangerous. Even if the woman was made out of only dimethyl sulfoxide, she wouldn't be dangerous. This chemical becomes dangerous when it picks up a couple of extra oxygen atoms and turns into different chemical known as dimethyl sulfate. Not sulfoxide but sulfate, which was used in World War I as toxic gas. Vapors emitted by this war gas are known to cause a serious sickness and even death. What is even more strange is that it has a delayed effect. But how the hell the medicine substance turned into a deadly gas? Well, one of the theories is that when emergency workers gave oxygen in emergency room, these chemicals reacted and turned into a war gas. However, scientifically, this conversion is kinda sketchy. It has not been scientifically verified. There is also a theory that shocks made by the defibrillator could have then converted the chemicals. Also, the change in temperature of the blood drawn from the 98 Fahrenheit or 37 Celsius of Ramirez's body to 64 Fahrenheit or 18 Celsius may have contributed to its conversion. So the answers are still not 100% clear. It is also weird that Gloria's body was kept at faulty freezers, so the body decomposed. Not only that, but also her heart was removed by coroner and ended up missing. The official cause of the death of Gloria Ramirez was kidney failure. Gloria family believes that this is a cover-up and hospital was up to something. There also were some cases in that hospital of other patients getting unwell and smelling ammonia. In 1997, the journal Forensic Science International published a study offering a chemical explanation for the events associated with the death of Gloria Ramirez. The study agreed with Dr. Grant's hypothesis of dimethyl sulfate vapors responsible for the events associated with the death of Gloria Ramirez. And that's pretty much it. Even till this day, nearly 3 decades later, this case seems to be very strange and unexplained. It had cover-ups, strange sickness of hospital staff, strange toxic chemical, oozing woman, and lack of explanations. Still not as toxic as COD Lobby.